Should you really go on bed rest for 24 to 48 hours after your embryo transfer? This is one of the most common questions I get asked by my patients who are preparing their bodies for transfer and are also given advice by their clinics. And some clinics do say 24 to 48 hours of bed rest is necessary. And other clinics will say the opposite, that it can contribute to less circulation, therefore is not great for the outcome. So what is it? Hi, I'm Michelle Orbitz, a fertility acupuncturist and host of the Wholesome Fertility Podcast. In today's episode, I'm going to share research when it comes to whether people should be going on bed rest after an embryo transfer. But I'm also going to share some tips on what you can do for a successful embryo transfer. But before I get started, be sure to speak to your practitioner or doctor and know that this is not medical advice. I'm just sharing information to educate you, and that you could take this information and speak to your doctor before doing anything, because your case is unique. And although I do traditional Chinese medicine, I'm not working with you specifically and I don't know your case. So this is more of an educational video. And before I get started, be sure to hit like and subscribe so that you can get notified for future episodes where I share lots of great tips on how to boost your fertility. So let's get started. So for years, clinics have been saying that after an embryo transfer, people should go on bed rest for 24 to 48 hours and basically not do much. And the idea was that laying flat is going to be optimal for helping the embryo stick. But here's what the research shows. In some cases, they say that it makes absolutely no difference. And in other cases, it actually shows that people who are a little more active, and we're not talking about exercise, just moving around, have a better chance of a successful embryo transfer than those who are on bed rest. And some clinics do not advise to rest for 24 to 48 hours after transfer. In fact, they believe that if you move around, you're going to create more circulation and it's better for the outcome of the transfer. So from a traditional Chinese medicine perspective, it does make sense that if you're not moving around a lot, you're going to create more stagnation in the body, and you want to create more blood flow in order to support the new embryo growth and implantation. But ultimately, I do suggest that you speak to your doctor, because every doctor has a different theory on this. And then what you could do is bring this to their attention if it is something that you're concerned about, and then ask them what their thought is and if there's any studies that back up what they're suggesting. But I also want to cover a couple of different things that you might want to look into when you are preparing your body for transfer and what you could do to really support the outcome. So I am a licensed acupuncturist and I specialize in fertility health, and I frequently support women who are going through the IVF journey. And one of the biggest things that I say is more timed and is really, really vital when it comes to transfers is getting acupuncture before and after the transfer. There's a protocol that has been shown to really help the outcome of the transfers, and I personally have seen incredible success with it. But even way before that, I would say even a couple of months, it's really important to get acupuncture so that you can increase the blood flow to the uterus, and do this regularly so that it's not just a one-off acupuncture session. And oftentimes I suggest for people to get maybe twice a week before and leading up to the transfer. And I often suggest on warm, nourishing foods before and after the transfer. So things like bone broth is really supportive. And then before that, you can do beets, which are very high in nitric oxide, and they support blood circulation. And that is really something that you want to do so that you can support more of that blood flow for that healthy uterine lining. And from a traditional Chinese medicine perspective, warming foods such as bone broth and soups and stews are very supportive to a warm environment in the womb, which from a TCM perspective supports receptivity. And some of the supplements I often suggest are continuing CoQ10, because CoQ10 is also really good for egg quality, but it's also amazing for uterine lining. Vitamin E is really great, omega-3s, your prenatal vitamins, and L-arginine. Now, all of these things really depend on the clinic. Sometimes the clinic has their own method and protocols, and they prefer that you don't take certain supplements. So I would always make sure that you are on the same page with your doctor. And ultimately, I highly suggest working on your nervous system. So doing things like meditation and really working on the stress levels. And oftentimes, a lot of my patients have full-time jobs while they're going through this. And many times it's in secret. They don't really want their work to know what's going on in their personal life. So I often suggest taking that week off before transfer, really getting your body prepared so that you can mentally get a little break and a buffer from any other stressors. And what's been shown to also improve outcomes in embryo transfers is laughter therapy. So there was a study done and it was clown therapy, and this clown would come in and make people laugh after their embryo transfers. And the people that got exposed to the clowns and were laughing had an increased rate of pregnancies versus the group that did not have that. So I often suggest watch comedies, and if nothing else, it really takes out the stress of the whole time and the 2-week wait. So it's kind of good as one other way to possibly get your mind off things, although sometimes it's impossible. One of my dear friends and colleagues, Monica, is the author of the IVF Planner. And in there, she has some adult coloring pages just to get your mind off the 2-week wait. So it's not often very possible to get your mind off it completely, but there are certain things that you can do to keep your mind occupied. And one of the ways to do this is really getting your hands busy. So any kind of craft or drawing or coloring or even taking walks can really shift your perspective, because when you're changing your physiology or doing something different, it can help take the edge off from the 2-week wait. I do also offer hypnosis audios, and one of them is for uterine lining and receptivity. So a lot of the different audios can shift and change depending on where you are in your journey or if you're going through the IVF journey. And this is in my membership, which includes lots of hypnosis audios, and you can find that in the episode notes. But all in all, really giving yourself that TLC, that time and support, possibly having a community around you or people that you can talk to during this time, because I know that it could be really difficult for some people, and some people are going through this after loss. So it's really, really important to have self-compassion and have tools ready so that when you do need something, you're able to readily access it. So I hope you got a lot of good information from this episode, because it is a very frequently asked topic. And that's why I thought about speaking specifically to embryo transfers and how you can really support that in your journey. So thank you so much for tuning in, and I'll see you next time.